You are looking at a plant that your great-grandmother used for everything from fevers to indigestion, and modern research just confirmed something remarkable. But not everything in her garden was safe. Some remedies were dangerous myths, and a single study from 2022 flipped everything we thought we knew about one backyard herb. I will show you which plants actually work, and which ones could send you to the emergency room. For centuries, every grandmother had a medicine cabinet growing right outside her kitchen door. Sage for sore throats, ginger for nausea, St. John's wort for the mind. But buried among the remedies that worked were ones that cured nothing and others that could harm you. And when researchers finally put one of the most common garden herbs to a rigorous clinical test, the result was so unexpected, it forced scientists to rewrite what they thought they knew. The story of how we got here begins not in a laboratory, but in a cave. 13,000 years before the first clinic opened, humans painted herbs onto rock walls. By 1550 BC, the Ebers Papyrus recorded willow bark for pain, garlic for the heart, and dozens of remedies that we now know actually worked. In colonial America, immigrant gardens grew sage and mint alongside Native American plants like echinacea and golden seal, creating a folk pharmacopoeia passed down for generations. It was real medicine, and it saved lives. In fact, roughly 25% of all modern drugs trace back to plants first identified in those backyard gardens. Aspirin from meadowsweet, the cancer drug paclitaxel from the Pacific yew, even ephedrine. So, when your grandmother handed you a cup of chamomile tea for a restless night, she was tapping into something ancient and powerful. But here is where the trouble began. For every plant that healed, another one promised cures it could not deliver. And the people pushing them did not know the difference because the science simply had not been done. That changed in a way nobody saw coming. In 2022, researchers at a major university decided to test one of the most beloved backyard plants, a plant that millions still use for migraine headaches, a plant that appears in virtually every herbal handbook. They designed the largest, most rigorous placebo-controlled trial ever conducted on this single plant, and the results were so unsettling, so completely contrary to what everyone believed, that the lead author issued a statement that read like a warning label. Not about the plant's failure to work, but about something far more alarming. The full force of this revelation is exactly what our ancestors never knew, and it is about to change every bottle in your kitchen cabinet. But first, I need to tell you about a different plant, one that proved the opposite is also true. The plant is St. John's wort, Hypericum perforatum. If you have ever doubted whether a backyard herb could rival a pharmaceutical, this one silences the doubt. In 2008, a Cochrane collaboration meta-analysis examined 29 clinical trials involving over 5,000 patients. Their conclusion was unequivocal. St. John's wort is more effective than placebo for mild to moderate depression, and as effective as standard prescription antidepressants, with fewer reported side effects. The standard dose is 300 milligrams, taken 3 times a day. Full effects develop within 4 to 6 weeks. That is not folk medicine. That is gold standard evidence. But the plant that changed my mind about herbal remedies was not the one treating depression. It was the one your grandmother grew to put in stuffing, sage. In 2021, a double-blind placebo-controlled trial in Germany tested a sage throat spray against acute viral pharyngitis. The group that got the genuine extract experienced significant pain reduction and faster resolution of symptoms within 48 hours compared to the placebo group. The study confirmed what ancient healers wrote down 4,000 years ago. Sage is anti-inflammatory and antimicrobial, and modern science now proves it. Then there is ginger, not the powder at the back of your cabinet, but the fresh root. A systematic review of 7 randomized controlled trials found that ginger significantly reduces pain intensity in primary dysmenorrhea. In some studies, the effect was comparable to mefenamic acid and ibuprofen. Just 1 gram of powdered ginger per day for the first 3 days of the cycle was enough to change outcomes. But here is what nobody tells you. The ginger you buy off the shelf is not the ginger that was tested. In 2015, researchers analyzed 20 commercial ginger root supplements. The active gingerol content varied from undetectable to over 3 milligrams per g-ram. Not one matched the dose used in clinical trials. That is a problem that cuts across every herb we are talking about. The science that proves these plants work only applies to standardized, carefully prepared products. And when you walk into a health store, you have no idea what you are actually buying. That gap between the clinical data and the consumer product is enormous, and it has serious consequences. Which brings me back to St. John's Wort, because in 2022, a massive prospective safety study tracked 4,200 patients taking the herb alongside their usual medications. The findings were so stark that the journal Neurology published a special editorial. St. John's Wort is a potent inducer of the cytochrome P450 enzyme system in the liver. That means it accelerates the breakdown of over 50% of all prescription drugs, transplant rejection drugs, HIV medications, warfarin, oral contraceptives, and antidepressants. The 2022 study found that patients combining St. John's Wort with SSRIs experienced serotonin syndrome at 3 times the expected rate. Those on blood thinners exhibited unpredictable in-and-R fluctuations, and a subset of women on oral contraceptives became pregnant because the herb rendered their birth control ineffective. The plant that works is also the plant that can undo everything else you are taking. And that paradox is the quiet truth at the heart of every leaf in your garden. But when scientists turned their attention to the herb your great-grandmother grew for fevers, they found something that makes the St. John's Wort revelation look like a footnote. That story is next. The herb your great-grandmother grew for fevers is feverfew, Tennesetum parthenium. For over 2,000 years, it was the go-to plant for headaches, arthritis, and any fever that came through the door. Medieval monks called it the aspirin of the monastery garden. By the 1990s, you could find feverfew capsules in every health food store, promoted for migraine prevention. The belief was so strong that few ever questioned it. Then came the largest, most definitive clinical trial ever conducted on this plant. In 2022, a team at Harvard-affiliated Brigham and Women's Hospital randomized 832 chronic migraine patients to receive either a standardized feverfew extract or a placebo. The dose was 100 milligrams of parthenolide standardized extract daily, exactly what the supplement industry recommended. The trial lasted 6 months. Every participant logged headache frequency, severity, and medication use. The blinding was strict. The statistical plan was pre-registered, and when the data were unblinded, the researchers stared at the screen in silence. The feverfew group experienced an average of 4.3 migraine days per month. The placebo group experienced 4.1. The difference was 0.2 days, which was not statistically significant, meaning the plant performed no better than a sugar pill. But the adverse event rate in the feverfew arm was significantly higher. Mouth ulcers, gastrointestinal distress, and a phenomenon called post-feverfew syndrome, where stopping the herb triggered rebound headaches. that were worse than the original migraines. The lead author declared that the risk-benefit ratio no longer supported routine use. A plant trusted for millennia had just been undone by a single well-designed study. But the real shock was not feverfew. It was what the trial revealed about the entire structure under which these plants are sold. In the United States, dietary supplements do not require pre-market approval. The FDA cannot test them for safety or efficacy before they land on shelves. A landmark investigation published in JAMA Internal Medicine analyzed 44 herbal products from major retailers. 59% contained substitutions of plant ingredients not listed on the label. 32% had zero detectable DNA from the specified herb. You could be buying a capsule of powdered rice and cellulose with a label that says feverfew, and no agency would catch it before you swallow it. In 2018, the journal Hepatology published a registry study showing that liver injuries linked to herbal and dietary supplements had nearly tripled in a decade. Some were from well-known toxic plants like kava and comfrey, but many were from common kitchen herb products contaminated with heavy metals, pesticides, or pharmaceutical adulterants. One turmeric supplement tested by the FDA contained diclofenac, a prescription non-steroidal anti-inflammatory, ground into the powder without any label disclosure. Here is the paradox. Sage works. Ginger works. Staint. John's wort works powerfully enough to rival drugs. But the evidence does not transfer from the clinical trial plant to the bottle on the shelf. The St. John's wort used in studies is pharmaceutical-grade extract standardized to 0.3% hypericin. The product you buy may contain anything from 0 to triple that amount. The same is true for gingerol in ginger and thujone in sage. So when your grandmother handed you that herbal remedy, she was using a plant from her own garden, grown in soil she knew, processed with her own hands. The transfer from that tradition to a global supply chain is where the danger hides. And that creates the question that drives everything that follows. If some of these plants are genuine medicine, and others are useless or toxic, how do you tell the difference? More importantly, what does a modern person with no botanical training do when they walk into a store and face an aisle of bottles that all claim to heal? The answer comes down to one principle that the supplement industry has spent decades trying to obscure. That principle is the bridge into Act 3. The principle is this: a plant is not a medicine until you can identify its active compounds, standardize their concentration, and prove they work in a human body under controlled conditions. That is the line between the backyard and the pharmacy. Sage earned its place because researchers isolated thujone and rosmarinic acid, standardized them in extract form, and showed they reduce throat pain in a randomized trial. Ginger earned its place because gingerol content was measured and matched to pain reduction in clinical endpoints. St. John's wort earned its place because hypericin and hyperforin were standardized to 0.3% and tested against prescription drugs. Feverfew failed that test, not because the plant is worthless, but because the product that reached the trial did not deliver consistent parthenolide, and the evidence collapsed under its own weight. So, how do you know what you are holding when you pick up a bottle? There are 3 markers you look for. First, the label must declare the specific plant part used and the extraction solvent. If it only says aerial parts without concentration, put it back. Second, look for a third-party certification seal from organizations like the United States Pharmacopeia, Consumer Lab, or NSF International. These groups test random retail samples for identity, potency, and contaminants. Without that seal, the odds that the product matches the label are barely better than a coin toss. The JAMA study proved that. Third, you verify the standardized marker compound. For sage, that is rosmarinic acid. For ginger, it is gingerol. For St. John's wort, it is hypericin. If the bottle does not list a specific compound and its concentration, you are buying a guess, not a remedy. But even when all three markers are present, the most important rule is one: your great-grandmother never had to consider drug interactions. The same liver enzyme system that makes St. John's wort so effective against depression is the system that metabolizes half of all prescription medicines. Turmeric can inhibit it, echinacea can induce it, and if you are already on a pharmaceutical, adding an herb without medical supervision is not natural. It is a chemistry experiment conducted inside your own bloodstream. That is the part of the folk medicine inheritance that got lost in translation. In the old garden, the plants were used alone or in simple teas for acute conditions that rarely crossed paths with lab-synthesized drugs. Today, a single capsule can contain a dose of hypericin that does the work of 30 cups of tea, and if you take it alongside a blood thinner, you could wake up in an emergency room. The most dangerous herb in your garden is not the one that fails to work. It is the one that works well enough to interfere with everything else. But here is the detail I have saved until now, because it changes how you will read every label from this moment forward. In 2024, a meta-analysis from the Swiss Institute of Natural Products reviewed 150 herbal trials and found something consistent across every plant that actually worked. The effect size correlated almost perfectly with the chemical composition of the administered product, not with the brand, not with the claims, not with the price, only with the molecule. The herbs that heal are not mysterious gifts from nature. They are delivery systems for specific chemicals that follow the same laws of pharmacology as any drug. The moment you understand that, you stop seeing the supplement aisle as a folklore museum and start seeing it as a poorly regulated pharmacy. Your job is to find the few bottles on the shelf that actually contain the medicine they promise. And the next video will show you exactly which ones those are. Starting with a plant the Amish never stopped growing. The plants your great-grandmother grew were never the problem. The problem was the 80-year gap between her garden and the laboratory, a gap filled with unregulated products, missing molecules, and marketing that outpaced science. But the evidence is finally catching up, and it is telling us something worth remembering. The same backyard that grew harmless sage and dangerous feverfew also grew half the molecules in the modern pharmacy. The difference between remedy and poison was never in the leaf. It was in the dose, the standardization, and the honesty of the person selling it to you. If this made sense, I put something together you will want to see. The link is in the first pinned comment below. Hit subscribe and tell me in the comments what herb you grew up with and whether it passed the evidence test or failed it. I read every single one.